Hello, everyone. John Newstreet, Kissimmee, Osceola County Chamber of Commerce President and CEO, welcoming you to another 15 Minutes on Timely Topics webcast. Today, we are sponsored by Orlando Health, who, like the Chamber of Commerce, are champions for business and community. So we're delighted to have you with us. We got a great guest today talking about a timely topic. So I'll introduce him now as we bring him up on screen. He is Dr. Federico Laham. He's the medical director for Orlando Health Arnold Palmer Hospital for Children, Infectious Diseases. Dr. Laham is board certified in pediatrics and pediatric infectious diseases. We'll have his entire bio in the Facebook thread. If you have questions during the show, please let us know. We'll be monitoring that chat and try to get the doctor to answer those questions for you as they come in. And lastly, I'll say before I start the conversation, he is chairman of the Infection Control Committee. So the topic today, of course, relates to the flu and COVID-19 and infectious disease. And it goes without saying, now that I've told you a little bit about him, that he's an expert in this field. And we're delighted to have you with us, Doctor. So thank you for being with us.
Thank you, John. It's a pleasure to be with you today, and I'm looking forward to our chat.
Yes, sir. So we'll get right into it. There is a lot happening in this space, and here we are in the fall, which is regular kind of flu season. I've been getting a lot more emails saying get your flu shot. There's some great partners in the community that'll even not only give you a free flu shot with your insurance, but also give you a $5 or $10 gift card. I know we've got Publix and Target and some of these large folks. If you go there and get your flu shot, they give you that card. Talk to us about the flu, how it differentiates from COVID-19, the importance of the vaccine that's available now for the flu. So just talk to us about what we're seeing and what we should do for the flu, the regular flu, and how it relates to COVID-19.
Perfect. Thank you. And thank you for taking me out of the world of COVID for a little bit. So, well, we all know about the flu. Is every year we kind of get to hear about the different variations, but this year is going to be particularly special because we have what some people have called the twindemic, in which we have a current pandemic with COVID, and we are kind of bracing to see what another layer of another virus can do on top of that. Like you mentioned, John, these two viruses are very similar. They both produce respiratory illnesses, and at times they have similar symptoms. We see that in our patients, commonly fever, fatigue, sore throat, congestion, cough. So, it's the flu, right? The one thing that we know, and it's pretty obvious, that COVID has proven to be much more contagious, and in some cases associated with much more rapidly progressive disease for those who unfortunately can take a wrong turn. Flu comes in two flavors. You have the seasonal flu, which year to year may have small variations in the viral structure that make it unique, and that's for that reason every year we have to reformulate our flu vaccine. But once in a while we have major shifts in their genetic makeup, and the last time that happened in that scale was in 2009 with the swine flu that started in Mexico and then rapidly progressed into a flu pandemic. It's interesting that ever since, that virus has continued to circulate and actually be one of the best sellers, despite having persistent circulation and vaccination every year against that strain. That talks about the power of introducing a new virus. And I remember back at a time when we had the 2009 flu, what we saw, because that virus really emerged around March, I think it was around March, and then we started having flu I was in Houston at the time, and we had flu in the middle of the summer. Here in Florida, it's a little more common, but probably not so much in Houston. And it was a very disruptive virus that pretty much pushed out every other virus that was circulating in the community at that time, and it just became like a monologue, like no competition. And we have seen something similar with COVID this year, in which we have seen a much pronounced decrease in the other viruses that commonly circulate to see predominantly COVID. There are many reasons for it. The obvious reason has to do with social distancing and just people kind of congregating and being one of congregating at home or in small parties, and being what the predominant virus is probably the only virus that circulates now. But what's going to happen when flu comes? Because usually flu doesn't like other viruses. They tend to be, it's one or the other. However, we have seen, and I think that we're gonna brace for some overlap.
So we mentioned children in the header for today's topic, and that's certainly your specialty is pediatrics. Can you talk to us about how children are or aren't carriers or exposed to this, and extra added precautions that we need to take related to children?
Sure, great question. So the one thing that we saw early on, we were waiting to see like a tremendous impact in children, and from the very beginning. And the reality is that children get infected probably at a lower rate, and they get sick at a much lower rate. Overall, the CDC has reported of the like 600,000 cases that they have reported in children. So when you look at all of all the cases that have been infected, less than 10%, about 9% have been in pediatric patients, ages 0 to 18. So about 10%. So the bulk of the infections have been in older people. Now, it may be that more children get infected, but we just don't know because they're asymptomatic, and for that reason, people don't seek care, don't seek testing. However, of those, even though pediatric patients constitute about almost 10%, they are almost less than 1% of the admissions to the hospitals. And the mortality of COVID in children under the age of 18 is 0.06%. So it's a huge discrepancy. If anything, that's the silver lining for us pediatricians, is that we have blessed in the sense that we have not seen the disastrous consequences that COVID has had for the older population. It should give us a moment to think about 225,000 people have already died to this terrible virus.
So does that mean parents should be reckless and not worry, or that there's still danger out there? And how does that relate to them possibly being carriers? So my mother-in-law may be living with me and my 2-year-old, and so are they carriers? Have we seen any instances of that even?
Exactly. That was the second part of your question. So we know that children don't get to become ill to the same rate as the elderly or the adults. However, they can transmit the infection to other children and to older individuals. It appears that their effectiveness in doing that is they're not great. They're not great vectors in the sense that they won't pass the virus very effectively, but they can. So that's why when we went through school reopening, we were very cautious in the way that it was done, and all schools should continue to observe those protocols in terms of universal masking, strict hand hygiene, and social distancing. And so far, they have proven to be effective. Interestingly, several publications in different parts of the country have shown that when school cases, like clusters of school cases, have occurred, usually that is linked to extracurricular activities, perhaps a sports league competition, or maybe a school birthday party in which many children of the attendants in school were invited, or in which families were kind of closely together. It does not appear to be so much the in-class setting as compared to what kids do after. So there are cases in which there's transmission. As I mentioned, they're not associated with increased severity of disease in children, but they can act as vectors in putting older people at risk, especially the elderly.
So business owners are planners, and you're an expert in infectious disease as we go through this twindemic. Do you have a timeline that we should hunker down and say good, better, best? Or I hate to put you on the spot, but just kind of getting your feel for, hey, this is what you kind of want to plan.
So back in March, we were trying to figure what was happening with the pandemic. We got a peak of cases in April in our hospital system. Orlando Health is a consortium of many hospitals, so we serve a large 4-county community, and we saw a spike in cases, and then things kind of quieted down, and we say, we're lucky, now we can plan better. And then in July, we have a wave of patients, like surpassed 10 times what we saw earlier. Then things start to come down, and now we are the same kind of plateau levels, but we expect things to heat up again when we are seeing, and in most of the United States now, cases have gone up by 40%. We expect that with the with the winter coming and people moving more indoors, there's going to be less opportunities for kind of distancing in the household, and usually are conditions that are more favorable for viruses to transmit. So at the end of the day, nobody really knows exactly how this is going to go. The major disruptor is going to be the availability of the vaccine, although we don't expect that probably until early next year. And keep in mind, it's going to be like a phased approach in which people at higher risk will be immunized, perhaps first responders and healthcare providers, followed by the elderly, and then successively, going down. Perhaps children will be the last to receive the vaccine because, as I mentioned, they are not at so much risk for getting the serious consequences of the virus. Mm-hmm. So business owners need to continue to plan. I think at this time, what study after study have shown is that masking has cut down transmission remarkably, at least 75 or 80% in some series. So, I think that currently all protocols for, safe business reopening should consider masking as an integral part of their response.
And so that brings us to really best practices and resources here in the final few minutes of the conversation. So masking does make a difference. It may not be the panacea, the cure, but it does make a difference. So if you can do that, we encourage that. But talk about other best practices as a reminder. I know we've heard it, but it doesn't hurt to remind them. And then the resources Orlando Health offers to the community, both businesses and school resources. I think we have a site we'll put up for folks to track.
That is correct, John. Orlando Health, we have been working diligently in helping our communities to stand up again. And, along the way, we try to obviously, combine science, combine, our resources, provide medical assistance, and provide the expertise where we can. There are several resources available online, from the government, from non-governmental societies, and I'm sure everybody else has their preference of where to consume the news. We know that this virus is very infectious, and it transmits mostly by respiratory secretions. So at times I see people really perhaps focusing way too much on objects, on touching surfaces, which is obviously we need to take care of that. But we cannot forget that the main transmission is through respiratory droplets. At times people also get kind of very focused or stuck in, okay, whether it's an airborne, I need an N95 and what I need to do. So for very brief encounters and brief contacts, just wearing a simple mask will do much of the job. One of the most challenging situations have to do with exposures in very close spaces or like small spaces. Receiving poor ventilation. I think that if you have somebody symptomatic, that person is likely to be eliminating viruses and just create more of a hazard. If the exposure is brief, probably it's not much of a big deal, and especially if people are wearing masks. But then anything but that, then it just adds to the risk. And right now we consider an exposure when you have that type of exposure over 15 minutes. We used to say 15 minutes in a sitting. And now we are talking about 15 minutes like cumulative, throughout the day.
Mm-hmm. Very good. So we've got all those resources available. We've got just a few seconds left. So we'll put in the thread if we're going to archive this conversation. We're live right now, but we'll archive it. So if anybody does have a question, please put it into the thread, and we will monitor that and try to get you answers. This is a very important topic. We're living in it. These are very strange times. So I'll give it back to you, Doctor, for maybe some closing remarks here, and then we'll close it out.
Absolutely. Again, it is October 28th. Usually by the end of October, we like everybody to have received their flu vaccine. And again, there's unfortunately for COVID, we don't have a vaccine yet, but for flu, we certainly do. Vaccine is already widely available in the community through your doctors, through major retailers, and the vaccine, it is efficacious. It decreases mortality. It decreases disease severity that might need to put you in the hospital, and it's easy to get. A single shot, unless you're talking about a child who never got it before, but usually it's a single shot, very well tolerated, and it's like you mentioned initially, John, is covered by almost all health plans, and at no cost because it's preventative and it has proven to work. There are also different type of vaccines. There's not really vaccine allergy that has been really proven. For very, very rare cases, there's also specially formulated flu vaccines. So please reach out to your doctor and try to get the flu shot, before we have the twindemic in full force.
Very good. We'll close with that, Doctor. Again, thank you for joining us this morning, sharing your expertise. Thanks for taking care of our children in our community. And we appreciate Orlando Health being the sponsor today and being a great partner here in the chamber. Again, we're all champions for business and community. So thanks for being with us again.
Thank you so much for the invitation, and thank you for keeping us running.
Yes, sir. Take care.